Hello, everyone. Welcome to virtual FSH Health Corps orientation. I am Megan Eldridge, the Vice President of FSH Health Corps programs, and I am so excited for you to begin your journey of service with us as we start a new program year. Today is all about getting you acclimated to our policies and procedures. We know that there are additional ones that you'll have at the site, but this is really just an overview of our program, how we partner with your sites, and what you can expect moving forward, as well as some practical things like how to submit a timesheet and things like that. So let's get started. So as we begin, we'll cover an FSH Health Corps overview. Again, this is our program at Family Scholar House. It's an AmeriCorps program. So AmeriCorps is mostly known for social justice and education efforts, but about 3 years ago, they went into public health. We have since transitioned into just focusing on healthy futures of patients overall in the states where we have members. It began at our organization, Family Scholar House, and we partner with nonprofit healthcare facilities, including hospitals, long-term care facilities, as well as any other nonprofit facility that has healthy outcomes as part of their goals for their organization, and that could include food banks or anything like that. It's a way for members like you who are beginning with us to earn money for filling an immense need in your community. So we know that there are a lot of gaps in service that happen as far as healthcare is concerned, and we want to put efforts toward filling those gaps with members who are prepared to serve. It's a way for you to gain experience that aligns with your long-term career and education goals. We know that some of you are in school, some of you are going to do further education after you end your service term with us, and some of you are looking to get into a job, and this is going to give you the experience you need to put on your resume and have the confidence to go into a career after this is over. And some of you may end up doing another term of service with our program, and that's awesome. It's also a way for you to stand out to colleges, build your resume, and get a jump start on your career. I can't express more heavily how good it looks on your resume to have an AmeriCorps experience, to talk about your passion for service and helping people, and your dedication to your community. And so now we will talk more about what AmeriCorps is specifically. AmeriCorps is nationwide. It is active in all states. There are all sorts of different programs, not just in health corps. So you are part of a larger network of service members across the country interested in service and helping people and filling gaps in service, not just in healthcare, but in education. And there are a lot of programs around tutoring support and helping people get out of poverty. There are a lot of social justice efforts too, and there's even newer efforts around mental health. They have a new mental health course. So there's a large network of service members you are stepping into. As an AmeriCorps member, you are a national service member. It's important to talk about the language of AmeriCorps, so you are not considered an employee, a volunteer, an apprentice, a paraprofessional, or an intern. We will use the term member throughout your service. We know that some of you may be utilizing the program to fill an internship or practicum requirement, and that's totally fine. We've worked with schools a lot to make sure our program meets certain criteria so that you can do that and get paid for your internship if we're working with your host site. But as far as the program is concerned, it's important that you know that you are a national service member. You receive a living allowance based on the hour commitment you signed up for and the slot type, but it is not called a salary or a wage. It's very specific in the way we break it down, your total amount by the number of pay periods you're serving, and it doesn't fluctuate based on number of hours served per pay period. So again, important to note that it is not a salary or a wage like a normal job would be, because AmeriCorps is not technically employment. It's also important to note that as a benefit of AmeriCorps, if you are receiving any state benefits or federal benefits such as SNAP or subsidized housing, AmeriCorps cannot count as income to put you over the edge for not receiving those benefits. So if you're in that situation and you're facing the loss of benefits because of the money you're making with AmeriCorps, please reach out to your program director or a coordinator with our program, and we'll help you get the assistance you need for that. We expect everyone to have a little bit of an elevator speech prepared to talk about what your service looks like with FSH Health Corps. There are going to be people, especially if you're working in a larger hospital system, who know that you're there to fill a gap, but not everyone gets the same information about the program, and you'll be wearing your member gear with logos for AmeriCorps and things like that. And they may have questions about who are you? Why are you there? Or even some of the patients might ask you about what you're doing and what is service. And so just having a few sentences to really get across that, hey, I'm serving with AmeriCorps. I'm really passionate about building healthy futures for my community. And this is one way that I am building my resume for my future career, but also getting this experience working hands-on with patients, or whatever it looks like for you to have that sort of speech prepared. As an AmeriCorps member, you made a commitment to national service, which includes showcasing the importance of service, demonstrating what it means to be an active citizen, and involving others in your projects or programs. Depending on what state you are in with our program, we have national days of service, so there will be service projects that you'll participate in throughout the program year, and some other things that might come up that you can participate in as well. But just knowing how important it is to serve your community. And we'll have a separate timesheet walkthrough video for everyone, because we have two different systems. So depending on the state you're in, you will receive a separate video for either Encore or America Learns. And now we'll walk through your member service agreement. So to get to this point in orientation, you've signed your member service agreement. Hopefully you know a little bit about what's in there and you read through it, but we're going to hit the highlights today. This is not a comprehensive overview of everything, but these are the main points we really want you to know from what you signed. A term of service is the duration from your start to your end date within the program year. During your term of service, you are responsible for following all program policies and procedures as written in the agreement you signed. And you understand that to be eligible to serve any additional terms of service, that you have to receive satisfactory performance reviews from any previous times you've served. There are 3 prohibited activities for AmeriCorps. This is not just FSH Health Corps policy. This is all of AmeriCorps across the country. There are prohibited activities, and the first one is religious activity. So this just means that as part of your role, you will never be assigned, nor can you be assigned, a duty like going to pray with a patient or reading a spiritual text with a patient. Doesn't matter what it is. You should not be giving spiritual guidance to a patient at your host site or something like that. A lot of our hospital partners or long-term care facilities are religiously affiliated, and that's totally fine, but they can never mandate that you participate in a prayer. If they do that at the beginning of the meeting, if you need to step out, you can. But really, as part of your service, your roles and responsibilities should not be religious in nature. The sites know about all these prohibited activities. We've never had an issue before, but if ever something comes up, please come to us. The next one is politics, especially in our political climate now. It's really important that you are focused on the tasks that you're there to do to benefit the site and the patients in your care. As part of your service, when you're wearing the AmeriCorps logo, you are representing a larger network, like I was talking about earlier, and we are not politically affiliated. So you're not promoting or against, being very vocally for or against particular candidates. You're not wearing political gear for a candidate or a party while you're serving. And a big piece of this, which it doesn't really happen for our program as much as other programs that are more social justice involved, but you're not lobbying as part of your service. So that's politics. And then union. So no union affiliated activity, which means if there is a union at your site, you are not replacing union workers, you're not getting involved in the duties that they're assigned. We will let you know if there's a union at your site. We really have very few, I think one in the history of our program where there's been a union, and we've worked through the ways to resolve that. So you may be asking, okay, well, I know what I can't do, but what exactly is allowed? Where's the line? So as a person, when you are not wearing your logo, when you're not counting hours for service on your timesheet, you can participate in any religious activities or worship of your choice. Our program is very open and inclusive, so we have all types of people who practice all sorts of different things, and that's totally okay. Just as part of your service and responsibilities, that's not part of your role with AmeriCorps. You can also, as a person not wearing your logo, not counting service hours, exchange verbal support a protest, attend a protest, things like that. Just keep it clean on social media as well, because we have that as policy. But yeah, as a person, you're free to participate and be an active citizen. Please vote, all those sorts of things, and advocate. You may not engage in protesting as an AmeriCorps member while wearing the logo, but as a person outside of the program, you absolutely can. Your benefits of service. You have a living allowance that does not fluctuate. I talked a little bit about that earlier. Your paycheck for your living allowance on the 15th and last day of each month, same days your timesheets are due, will be the same. We divide your total amount evenly between the pay periods within your term of service, so it does not fluctuate. As long as you're communicating time off to us, and we're able to black that out with our policies, and you're able to make up those hours, that paycheck will still come, but keep in communication with us closely. You also get a Siegel Education Award once you complete your service and you're in good standing and you finish all your hours. So that can be used to go on for further education costs at any higher education institution across the country, whether it's a technical school or a college or university. And even if you're graduating, you can use it within 7 years. So it can be used for one-off courses that you want to go back to get further education. Or if you're just going into college, that's a great opportunity to send it to your school. That becomes available in your My AmeriCorps portal after you are completely exited from the program. Here are our standards of conduct. FSH Health Corps members are expected to conduct themselves in a professional manner, uphold the signed member service agreement, and work within guidelines. So here are some of our top standards of conduct. This is not all of them, so please read in your agreement. But number one is always keep safety and security the top priority in all situations, especially because we are a healthcare focused program. Have a neat and clean appearance and wear attire appropriate for the service site. For some of you, depending on the state, you will have a uniform assigned to you with a shirt. For everyone, we have name badges with the logo that you should be wearing every day. But whatever it is at your particular site, it's important to make sure that you are identified as an AmeriCorps member at the site, and that you're wearing the uniform that's been assigned. Ensure your actions don't interfere with or disturb the normal operation of the host site facility. If at any time you feel like I am getting in the way of what they are trying to do and I feel like I'm not being helpful, have a conversation with your supervisor at the site and then get us involved as well. We want to make sure that you are there to benefit the community, the patients, and the site. So we'll make sure that we resolve those types of things. Demonstrate respect to fellow members, staff, and all beneficiaries. Beneficiaries, just a fancy way of saying anyone who's benefiting from your presence at that site. We want to respect everyone involved in the program. Remain in your assigned service area on tasks during service hours. Don't be on your phone. If there's a lull in the day during your shift, ask for something to do. Remain on task. Be proactive. We want you to be a sponge during this time, really learning the role you're there to do. And the only way you're going to be able to do that is to be proactive, to ask questions, to seek out opportunities to do more if that's something that you really are interested in. No drugs, alcohol, or tobacco permitted while you're serving. And check all the communications regularly, respond when asked. We'll often communicate through email. We'll often communicate through Encore or America Learns, the timesheet system, if you're late to submit a timesheet. We also have monthly support calls from our response center. That will be a phone call that we'll talk about a little bit later. But it's important that you respond to our team if we are reaching out. And if there's ever any issues, communicate with us frequently as well. With any standards of conduct, there's going to be consequences to violating those. So we'll work with you to resolve any conflicts, problems in the fairest way possible. But when unacceptable behavior, unsatisfactory performance or attendance, a breach in your agreement, or other disciplinary problems occur, the procedure below will be followed. The first notice will be a verbal warning. This will probably be pretty brief, a phone call, an email, letting you know, hey, there's an issue we're aware of. Please make sure that you're addressing this. Depending on the severity, the second and third will usually include documentation and be a longer conversation. And then either on the third or fourth time, we'll come up with a written improvement plan with dates and set goals that need to be met in order for us to feel confident moving forward with your membership. And when a problem has not been resolved in a timely manner with the given plan, we will move toward termination if there's no way to resolve it. In the event that the actions are sufficiently serious, if you bring drugs to the site, if you're if you say something negative directly to a patient, or for example, an abuse of the population you're serving, we will move immediately to termination without following this procedure. Non-duplication and non-displacement. This is particular for AmeriCorps. So members are supplemental support to the staff team at their site. They're never taking the place of staff, reducing staff hours, or filling a volunteer role where there would have been someone else in that place if you hadn't stepped in. The example I always like to use is if a site has 10 jobs posted on Indeed and we send them 5 people, they're not going to reduce the Indeed postings down to 5. They're going to keep hiring 10 because our people that are coming in, our members, are there to be supplementary. You should never feel like you're taking the burden of a staff position at your site. We have a Drug-Free Workplace Act, so the unlawful manufacture, distribution, dispensation, possession, or use of a controlled substance is prohibited while serving as an AmeriCorps member. The member must abide by the terms of this prohibition and must notify staff, whether that's me, your program director, someone on our team, within 5 days after you have a conviction related to any of the possession or use of drugs. Specific actions will be taken against members for violation of the prohibition, including termination. Our program specifically does not have a mandate to participate in a drug abuse assistance or rehabilitation program, but some of those resources are available through AmeriCorps, and we can connect anyone who needs those as part of the program rules. More specific details about actions can be found in the member service agreement. We also have civil rights. So FSH Health Corps seeks to be an inclusive program. No matter your background or beliefs, we want you to know that you will be supported through your serving experience with no discrimination. If at any point you feel you or someone else has been discriminated against, email me or your program director right away, and we will begin processing of that complaint. The full policy, again, can be found in the agreement. There's also a grievance procedure. Members are encouraged to address conflict through conversation with other members and their supervisors, depending on who you have a conflict with. But if there's a serious offense and you feel like working it out with the other person is no longer possible, that's when you'll get us involved and we can walk through the grievance procedure together. Here's a breakdown of service hours. So for each hour commitment you see here on the left, there is a max set of training hours that you can do and typical hours spent at the site. For most people, you are spending only around 24 hours in training with our program, so you'll be spending a lot more hours at the site. Service hours. So in some states, you may request a change to your service commitment. This is not applicable everywhere, but in some instances, you can extend your end date or increase your hour commitment if you have demonstrated capacity. You won't be able to do this right away. It's always best to have your term set in stone before you start. But if you find out, hey, I didn't get a job when I thought I was after school finished, can I extend through the summer? Let's have a conversation about that. But it's much harder to decrease your hours. In order to decrease your hour commitment, you must have a compelling circumstance approved, not just by us. We have to get it approved by our state commission. It involves a very lengthy process, and you'll exit with they call it a CPC, compelling personal circumstance exit, with a prorated education award, not the full ed award. So if you're ever in a situation where something has happened to you to negatively impact your ability to finish your term, that's when we would start this process of determining if it's a compelling personal circumstance. If you finish all of your hours more than 2 weeks before your end date, you won't be able to receive your full pay because you're not going to be able to get your last check. Because you have to serve the minimum hours per pay period unless you've communicated a blackout date to us. You have to serve that minimum amount to be paid for each pay period. So not having any hours on your last timesheet will force us to withhold that last paycheck. So just a note to make sure you're not finishing too early. If you decide to end service early without finishing your hours, you'll be exited for cause. You won't be able to participate in another AmeriCorps program. And so just know that is also one of the rules. As far as training hours go, we have 3 designations for training that will be assigned from our program. It's orientation that you're doing today. You can put 2.5 hours on your timesheet for that under the training category in your timesheet. Usually this is done over Google Meet or a virtual recording like you're watching today. There are career readiness training sessions available for at the end of service if you would like to. Up to 5 hours. Usually it's just a 1-hour session and then any follow-up that you may need. Embrace training modules, which everyone has to do, either 24 or 60 hours. Most people are doing the 24. And you'll do that in the Embrace platform and log those hours in the training category of your timesheet. Anything that our program assigns for training goes in the training category. Anything your site assigns is service. Anything that you do for the site, even if it feels like onboarding or training, is part of your service. Only the things that FSH Health Core program staff give to you are training. Embrace online modules, part of the training we just spoke about. You receive your Embrace account login. Either you're participating in our pre-apprenticeship enrollment form, which you would have already filled out if you're part of that. That automatically triggers this email to go to you within a day of you filling out that form. Or it says Curleen, she's our Florida program director, but your specific program director, if you're not participating in the pre-apprenticeship, has signed you up for you. So it'll also trigger an email to come to you once they sign you up, which usually happens around the time that you're filling out your member service agreement or right after you sign it. If you don't see this email from Thumbprint Admin about your Embrace account with your login information, check your spam folder and let our program staff know if you're still not able to find that after you go through orientation, and we can figure out a way to make sure that gets through to you. Once you have your email with your login information, log into the system, make sure that everything's there that needs to be there. You're going to go to My Learning, which is right here. You'll see either the FSH Pre-Apprenticeship 24 or 60 course assigned to you under your learning paths right here. And then you'll be able to go down to the section and click Start, and it will walk you through each module, every course that is part of that learning plan. And we will be able to run reports to see your progress. So make sure that to be accurate in your reporting in the training section of your timesheet for the pay period where you were doing these modules, we will have to pull reports for accuracy. So if you put, I did 10 hours, but you only did 5, we're going to reject your timesheet and make you edit it. So to save time, just make sure you're being really accurate about what the system says for the timesheet that you are submitting. For some states, you'll have a schedule breakdown. That will come directly from your program director. We won't walk through it today, but if you have questions about that after you receive it, you can let your program director know. We do have monthly check-ins with a response center representative. They'll reach out to you each month to complete your monthly check-in over the phone. It's just a few questions. They will most likely be calling from 502 area code, but we do have a few more employees in different areas now. But we will try to let you know when the calls are coming. So we usually try to do it on a weekend when most people are available. If you don't answer, they will leave a voicemail. Please call them back. It's just answering a few questions they have to input into our system. If you don't answer and you don't return the call after they leave a voicemail, you will be required to set up a virtual meeting with your program director to talk through the questions, which will just take you more time. So it'll just be better for everybody if you follow up with these questions about, are you on track to finish your hours on time? Do you need support? Do you have any feedback about the site? What skills are you developing in? And all the things like that. Just know that it is ultimately your responsibility to fulfill the commitment you have to service. Take initiative. We're here to support you, but we can't do the service for you. So please keep us updated on how we can support and take responsibility for finishing your service. Okay. And now we get into the member evaluation. So you are Usually, typically evaluated twice, depending on how many hours you committed to. So, if you are from 300 to 675, you only have one evaluation at the end of the program year. If you are 900 or 1200, you have two evaluations. You will have a midterm and an end of term because you have a higher commitment. So, I'm going to um, exit this, and I'm actually going to show you what that looks like. All right, so this is our member evaluation. You will have your supervisor from the site fill this out on your, not on your behalf, but for you, evaluating your performance at the site. They'll fill out their information at the top and who you are. And then these are the categories for what they're evaluating. Are you showing respect? Are you taking initiative in your growth and development? Are you flexible and adaptive to change? Are you meeting deadlines and commitments? Are you regular in attendance and punctual? Are you contributing to a positive work and learning environment? Demonstrating positive work habits, appropriately following up with relevant staff when needed? Effectively managing your time, staying on task throughout your entire shift, wearing the appropriate uniform, and maintaining confidentiality. So those are on a sliding scale. And then we also have some open-ended questions. What were your strengths? What could you improve on? And if they had an open position, would they consider hiring you? If there's anything else they want us to know about your service. So none of these should be a surprise when you go to be evaluated because we've covered them now, but a lot of these also are in our standards of conduct. So, all right, so let's move on from the evaluation. Just to review everything we've covered so far, FSH Health Corps is an AmeriCorps program facilitated by Family Scholar House. You have a team here to support you. You have a peer group to support you and serve alongside you. You signed a member service agreement. That is your resource when you aren't sure what the rules are. We have prohibited activities. Those are no religious, political, or union affiliated activity permitted on serve time. You are expected to uphold the standards of conduct. Disciplinary action will be taken if the standards of conduct are not upheld. Keep track of your service hours. Complete your training in a timely manner. Make sure all of that is logged correctly on your timesheet and in the right category. And get familiar with timesheet tracking after this. There's going to be a video after you complete this one just for timesheet systems, and we really want you to make sure that is completed. Next steps, track your hours for orientation as a way to get some practice in Encore or America Learns. Your orientation date at your host site is determined by the host site. Some of you are starting today. Some of you are starting in the next week or two. If you don't have that date determined with your host site, please reach out to your coordinator to let them know that date is not set yet. Onboarding instructions for your host site are provided either by us because we partner really closely with onboarding at your site, or your site provides them directly to you for orientation instructions. You'll get your member merch, either your uniform if you're in a state that has a required shirt, but definitely your name badge. Some areas have backpacks. We have some leftover umbrellas that we'll be sending out, but there's also notebooks and sunglasses that we will be providing to you, and you'll get all of that at your host site. Your first paycheck will come from pay entry. The dates are left blank here intentionally because people who go through virtual orientation will have different start dates, which will determine their first paycheck. But please follow up with your coordinator if you're not sure when that is. When you start, there will be a time where you will have, before you get the email instructions from pay entry, to fill out your direct deposit information, your tax information. It usually comes within a week of you starting. So please be on the lookout for that. Without your direct deposit and tax information, we won't be able to pay you. So it's really important that you look for this email from Pay Entry to fill out that information. Um, and if you have any issues filling that out, let our team know. And I think that's the end of the presentation. So next you will watch the timesheet video on how to submit your timesheet and fill that out in the system that you are assigned to, whether that's Encore or America Learns. And please let our team know if you have any questions. And there's also a competency form when you go through virtual orientation as opposed to the live version to make sure you understand what was covered today. So make sure you fill that out. Our team's here to support you. We're so happy that you decided to join FSH Health Corps, get this really great workforce development, work-based learning experience, and we can't wait to see where you go after your service with us.